name is Dr.S.Sahni. I'm a senior consultant breast surgeon. We've done so far on the management and disease-free and overall survival of breast cancer have shown that screen-detected cancers have the most fantastic outcomes. The European Institute of Oncology published their results in 2016 of 30 years of follow-up. The survival rate without disease coming back was 99.8% of women. And the difference in Delhi, when this is data which has been released by the WHO for 2013, America, in New York, the average size of a cancer was 7.5 millimeters. London was 10.2 millimeters. That has gone down now to 9.3. But Delhi stays pretty constant because even then and 8 years later, the size is 39.4 millimeters. So you're already talking about disease which has potentially not only grown in the system but also spread out into the system. And therefore, our outcomes will be definitely worse than they should have been had you gone for a test. It's like your car. You don't send your car, nice fancy car or any car that you have, you don't wait for it to break down before you send it to the company. You get services done at regular intervals. So just think of this as servicing your own body, which is such a fantastic machine. And please get your screening done. The other screening for women, as I mentioned, is screening for cervical cancer. And that is a pap smear done once a year. There are new technologies now where duration can be increased to once in 2 years, but I would still recommend once a year. It's a very simple outpatient procedure that your gynecologist can do, and it actually again saves lives. Again, early detection means not just for both breast and cervix, doesn't just mean better survival, it actually impacts everything, even financially. The cost of treating a screen-detected breast cancer is 1/8 of the same breast cancer being detected in a second or a third or a fourth stage. And also, of course, the treatment that you would get, the amount of physical impact it would have on your body would also be significantly less. Please get your screening done. It saves lives, it saves money. For breast, there's a mammogram once a year. For cervix, there's a pap smear. And if you are somebody who's worried about what their risk is or have been deemed at a high risk or just would like to know, there are alternatives which are available, which will be used going forward in conjunction with the normal screening methods. I said Easy Check. Easy Check is easily available now, and it's actually been being used internationally, and it's something that we should look at.